Friends, I am Dr. Surjit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Homeo-Prophylaxis and top 8 homeo-remedies for adenovirus. What is adenovirus? Adenovirus is a special type of DNA virus that causing a lot of troubles. But DNA virus causing a lot of trouble for last fortnight or so in West Bengal, especially affecting lungs of the minors, including death often. This virus, though chiefly affects the respiratory system, producing bronchitis and pneumonia, can also cause substantial damage to alimentary, urinary systems, along with conjunctivitis and mild type of nervous disorders too. Who are chiefly the targets? Targets of adeno. I will refer adenovirus in short as adeno throughout this video. So targets of adeno are persons with weak immune power, tender aged and aged persons. Initially, adeno takes shelter in tonsils, adenoids and intestines. During this period, there are no disturbing symptoms. However, the infected persons shed virus galore, that is huge, through sneezing, laughing, talking in atmosphere and sewage system from passing stool. Later, symptoms of respiratory system develop. On the right hand side, images, various images has been demonstrated, of which the last one I am interested to relate to. Icosahedron. Icosahedron means an object of with 20 plane, 20 planes. This is the shape of every adenovirus. 20 surfaced solid. How does adeno spread? Number one, from throat, namely tonsil, adenoids and nasopharynx, during talking, singing, laughing, crying, sneezing, coughing, etc. Virus spread through droplet infection via air. When droplets touch eye, nose, mouth, hands of healthy persons, the latter get infected. Number two, virus keep alive on smooth surface of doorknobs, handles, mice, keys, keyboards, etc. Mind it, if you think that I will wash all these surfaces with Dettol or something like this, this will not restrict the virus to spread, because these viruses are not amenable to the effect of so-called ordinary disinfectants like Dettol, other things available in the market. So it is useless to use this thing. Number three, leavings of food, drinks, etc. by infected person are also active source of infection. In most cases, hands of persons are the agent. Actually, for that particular reason, almost in every infectious disease caused by virus, hand washing is a must. Hand washing off and on. You can do any time you like. The more you do, the better you will feel. You will get the result. Because hands is the agent of carrying things to our nose, eyes, mouth, etc. Now, what are the signs and symptoms of adenovirus? On the right hand side, something is this. I got this pamphlet from internet. Air droplets, airborne, direct contact, that is hand in hand, indirect contact, that is from type of doorknobs, etc. Waterborne, foodborne, but not vector-borne. This is not vector-borne. What are signs and symptoms of adenovirus infection? Cough, throat pain, fever, high rate or labored respiration, loss of appetite. Patients suddenly get exhausted, thirst, urine scanty, dark, burn while passing, diarrhea or pain in liver, restlessness, bronchitis, pneumonia, conjunctivitis. Very rarely spasms with fever or encephalitis may be there. This is very rare thing, but maybe. How to break the chain of infection? That is prevention. To break the chain of infection, this is always also a pamphlet collected from internet. There are 5 steps. Stop at the source. That is the source, which is the source of infection. You can keep him in closed area, in say in a room, in the mosquito nets. So the source is limited. Then you can block the portal of exit. That is, whenever he will sneeze, cough, he will always use some object to guard, like handkerchief. Interrupt mode of transportation. That is mode of, that is, you have to, all persons, particularly who are not infected, have to wash hands again and again with soap, water. Protect the portal of entry. That is, the healthy person will protect his mouth, portal of entry, with some mask. Increased host defense. That's a fundamental thing of all disease. If you can increase the host of the person in general, the disease chain will break. So that is a, but that is not always possible, because there may not be available of all types of this prophylactic type of medicines are not available in the market, may not be. Otherwise, through fooding and daily lifestyle, you can also increase the defense of the host. But that is very not quite available easily, because it is a long drawn process. You cannot create a good defense through lifestyle within a span of say 1 month or 15 days. Not possible. It is the only thing is that if you get some prophylaxis, medicinal prophylaxis, that is good. The same thing chain has been described here. The letters are so obscure that is very difficult to follow, but if you can try, you can understand what is saying here. Aconitum from adeno, that is, we have come to remedies. Homeopathic remedy. High fever, too anxious, severe pain in abdomen, thrust. Generally trouble start after catching cold. Give aconite 3 every hour. Belladonna for adeno. Face red, high fever, pulse full, bounding, especially throbbing of carotids. Carotids you can see in front of the ears or at the temporal region, that is forehead. You can see the carotid throbbing. Heaviness in head and chest, abdomen bloated, vomiting of bile, no thrust. Aconite, thrust. Belladonna, no thrust. Belladonna 6, too early. Gelsemium for adeno. Face heavy, eyes full of water. Eyelids heavy. Heaviness in head, headache. Patient desire to be quiet, to let alone, do not want to speak. He or she is drowsy, trembling of limbs is there. Give Gelsemium 3x, 3 hourly. Eupatorium for adeno. Severe pain in bones, chilly, nausea, diarrhea. Use Eupatorium 6, 2 hourly. Lachesis for adeno. Abdomen hot, cannot be touched, very much painful, numbness from waist to thigh, sleep does not set easily, wash after sleep. Use 30, Lachesis 30, 4 hourly. Cantharis for adeno. Excruciating pain in abdomen, but no fever, much burning, pain in urination 2, pain in excluding the abdomen, urination 2 also. Use 3, Cantharis 3 every hour. Mark for adeno. tenesmus in anus does not ease after stool. That is, after passing stool, tenesmus is still there. Colic in urinary bladder, burning in urethra. Stool, urine both, hot, scanty, bloody. Use 30 marker 30 4 hourly. Collosine for adenovirus. Pain in abdomen so intense that patient bend double. Extreme restlessness. They attempt to get relief by deforming of body. Feel better from heart pressure. They are impatient. Throw things away. Give collosine 3x 2 hourly. Homeo-Prophylaxis for adenovirus. Arsenicum alb, phosphorus. Anyone will do 200, 4 to 5 globules 3 times on every 4th day. If necessary, the whole process can be repeated after a fortnight from the last dose. Now, what we will give? Arsenic or phosphorus? Though anyone will do, yet you can set some distinguishing feature, such as arsenic patient is a very perfectionist patient. They complete a job nicely and perfectly. Arsenic patient is a very perfectionist patient. So if you ask him and you go in a room, in his room, everything are in neat and clean and arranged in properly manner. Not even a picture will be tilted to one side. They are very much sensitive to this thing. So perfection is there. So you can ask few questions. You can know whether the patient is a patient of arsenic or not. In the case of phosphorus, phosphorus patients are lean and thin, very nervous patient. They are intelligent patient, very intelligent. And they like cold drinks, ice cream, cold food. Very much. So also you can ask this question to differentiate. If it is not possible to differentiate, you can give anything. You can give anything. No trouble. With this, the video ends. Thanks for listening or viewing. Any problem, write down in the comment section. I would certainly respond.